Good morning, everybody. My name is Bianca Kurtzen, and I'm with Constellation Consulting. We are pleased to present the New Mexico 2022 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Nicotine Use Prevention and Control Program. For more information about the summit, you can visit our website at nmhealthequity.org. Due to COVID, this year's summit will remain online. We appreciate everybody's flexibility and participation in participating in this year's event. I also want to remind our audience that today's summit is being recorded. And so by being in the meeting, you are consenting to be on camera, and we also will be sharing your name as it is on the Zoom. A couple housekeeping. I also want to encourage you all to utilize the Summit on Health Equity Whova app. The Whova app provides you with opportunities to network online, create discussion groups, visit exhibitor pages, download files provided by speakers, and also you could also watch back the recorded sessions at your own convenience. You can also please check the leaderboard in Whova for more information on that, where you can win some prizes and play some participation activities. For our session today, we are asking attendees to remain muted. If you have a question for today's presenter, you could use the Q&A function within Whova, and we will address as many questions that we can at the end of today's session. If you need assistance during the session, you could also utilize that Q&A feature and we could assist you, or you could email us directly at info@constellationnm.com. Following today's session, we appreciate if you take a few moments to rate and give feedback to our session. If you would like to request community health worker or social worker CEUs, please include your name and email address on your evaluation, and the CEU certificates will be emailed out within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. Finally, before we begin today, I wanted to say a couple thank you to our planning team, Chris Hollis, Kim Wu, and Mallory Chino for your time, for helping us find speakers and for planning this event. Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral lands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black and Asian and Pacific Islander communities with whom we stand in solidarity. We are New Mexico, and we are strong by the diverse people of our communities. There are a variety of organizations supporting equity throughout our state. We have listed just a few here. Nope, sorry about that. And encourage each of you to seek out and learn more, become involved, and support organizations who are building a better New Mexico for all. So without further ado, thank you so much, Christopher Ramirez, for being with us today. Christopher Ramirez is a co-founder and executive director of Together for Brothers. Mr. Ramirez brings an extensive amount of experience with anti-racism, community organizing, consulting, facilitation, fundraising, strategic planning, and so much more. You can read all of our presenters' complete bios in our event app in Whova, as well as our website, nmhealthequity.org. Please welcome Christopher Ramirez.
Thank you so much. Good morning, everyone. I'm seeing a lot of names and a couple of faces. And so just want to give a lot of gratitude to the organizers, but most important to you all, the participants who are here to learn and share with one another. I'm really hoping that we can create an interactive hour with each other. I am going to go ahead and share my screen so that I can share my slides with you all. And I'm also monitoring the chat and the Q&A on my phone. And thanks for that help for that this morning. When I was invited to speak, I really was thinking about what we've learned during COVID, right, which is not over, and what we've learned about most impacted communities, and particularly how most impacted communities connect to health equity. And so I'm excited to share some stories, some tools, and information that have been shared with me through community, through Ancestor, and through so many other experiences that I've had in our beautiful state of New Mexico. And so I'm excited to do that with you all this morning. Similar to the statement that was read earlier, thanks Constellation Consulting for making that statement, but I just want to acknowledge that I'm in Albuquerque on Tiwa and Caris lands, and Albuquerque and New Mexico are on Indigenous land. And that includes, right, the 23 tribes and sovereign nations, including 19 Pueblos, 3 Apache, and the Navajo or Dene people. And I'm just asking permission and blessings, including recognizing the land taken and resistance of Indigenous community for centuries. The organization that I work for, Together for Brothers, is committed to decolonization and Indigenous land, air, and water being back in the care of Indigenous communities. You already learned a little bit about me. I just want to do 2 things to make sure that you know that I'm a community organizer. And I really believe being a community organizer in New Mexico means that we really have to understand Indigenous ontology and epistemology. Those are the fancy words to say we need to understand Indigenous ways of being and knowing. And I'm going to really explain that in a story. I was in 2015, I was hired to work with a program called Juntos, Our Air, Our Water, an environmental justice program primarily focused on mothers and young people in Albuquerque's South Valley and Westgate neighborhoods, right? That were Latino neighborhoods in the city of Albuquerque that were most impacted by environmental racism. And as we were doing work primarily with immigrant mothers who spoke Spanish as their first and mostly only language, it was really powerful to me to really start unpacking their stories. And I'm going to give you three specific examples of 3 of the moms that I organized with, right? And one of them lived in a mobile home park that was next to a idling station. I'm going to come back to that. Another lived across the river from the sewer treatment plant in the South Valley. And yet another lived in the Mountain View neighborhood, really close to not one, but several cement factories. And as we were doing the work and understanding the problems that these immigrant mothers faced around environmental racism, around air pollution, something became really clear to me. And that is that there was a lot of stigma and in particular shame and embarrassment that the mothers experienced because they felt like they were knowingly harming their children and their families, right? Every mother that we organized with acknowledged that at least one of their children had a respiratory problem, usually asthma or other respiratory problems. And there was so much shame attached to living in these neighborhoods that were impacted by our environmental racism. And as we started to, and it really was hard then to identify a problem and solution if the mothers that we were organizing with were embarrassed by the reality of their situation. And so one of the powerful things that we realized is that we needed to make a lot of space for storytelling as healing. And not only were mothers able to connect with each other and be that support for one another and recognize that it wasn't an individual problem that they were embarrassed to talk about, it was a collective problem that had a collective solution. And while we were doing that, one of the things that was really powerful in that storytelling of their role as mothers and caretakers of their children and families is that we started to learn that it was, that this environmental racism was generational. Mothers started talking about moving from villages in Mexico where rivers had become polluted or where climate change was happening and crops weren't growing. So families moved to cities like Juarez or the border, even before coming to the States. And the powerful, again, piece of that was making space to tell story, to acknowledge some of this past and current harm was a way for these mothers to heal, a way for their children to heal and their families. And so I really want to focus today on some of the things that we've learned in the past year in New Mexico, especially in my work organizing with Together for Brothers, that really relates to this idea of how storytelling is medicine. And when I say storytelling, I want you to think of a big, big umbrella, right? A big umbrella in a New Mexico backyard or front yard or balcony that really encompasses all the different ways that we can and should tell story, telling story using art, telling story using languages other than English, as a way to do this really important work around health equity. Before I move on though, I want to learn a little bit about who is on the Zoom today. I can see that there are almost 50 of us, which is exciting, right? Because we know the work is so complicated and important for all of us to do together. But if in the chat on Whova, if you would be able to answer your name, your gender pronouns, you might use female, male, all gender or gender neutral, or other pronouns, so just share those. I learned from Kalihi Valley Instructional Bike Exchange in Honolulu, K-Vibe, that you bring ancestor into space so that you're never alone. Ancestor doesn't have to be a relative who's deceased, but you can bring the person that you're thinking about, a younger, older version of yourself. Some of our young men of color bring in their pets, and it could be a person younger than you. So bring an ancestor into the chat. And then I'd really like to hear and see in the chat, what are some of your rose, thorns, and blossoms? It's how we check in with the brothers and Together for Brothers. A rose is something positive today or recently. A thorn is something negative that you don't mind sharing on the Whova chat. And the blossom is just something you're looking forward to either later today or maybe in the coming week. So if you wouldn't mind, we're taking a couple minutes just to have you all make this space and make this circle this morning a little bit more community. And Suzanne and Bianca, my apologies, but I'm gonna ask you one quick favor to help me. I'm on Whova, and in the chat, I can only see my chat. I can't see the chat of others.
Okay, hold on just a second. So I just replied back I replied in the chat. Can you see my response?
I cannot.
And you may have to pull down to refresh your screen.
Thank you. That is exactly what I needed to do. I appreciate that technical assistance and support.
Okay, no problem.
Thank you, Liz. Thank you, Krista. And Santana, yes, we're using the chat in the Whova. So the chat that you used, if you could just do your introduction, name, gender pronouns, bring an ancestor in, a rose, thorn, blossom. And I appreciate some folks who are only doing even if it's one of those things, just wanting to see who is with us. Thank you, Arlinda. Thank you, Amanda. Thank you, Justin. Thank you, Maureen. Thank you, Norma. Appreciate those honest vibes. Great. I'm hoping that we can use, right, one of the things I know Suzanne was telling me is by using Whova, we're creating a real community space that although we can't be with each other in person, we're able to have some interaction with each other. So please use the chat and use the Q&A function throughout the presentation. I'm gonna move forward, but encourage everyone to drop even just your name in the chat so that we can see who's here with us today. So one of the things that I want to really start with, and thinking about that story that I shared about working with immigrant mothers around environmental justice, is that some of you probably know this already, but when we think of health equity, it's so important that we come with an assets-based approach, right? And in Together for Brothers, we really think of assets as both individual, collective, and systemic in really important ways that I want to share with you today. We use this asset map. So the start of anything we do where we start working with boys and young men of color, with community partners, we do this really important piece around understanding what are assets we have individually, and then when we share those, we can see collective assets. So you can see in this very rough graphic that we actually started using back in 2016 and still use today, we are interested in thinking about what our goals are, what our interests are, what are our networks, our skills, and then most recently, and this was actually like in 2018, so it's not so recent, we added values and really thought of those as being the core of the asset map. And so I want to talk a little bit about what those 5 areas of the asset map are. And then I want to hear from you all in the chat, what are some of your assets? So when we think of interest, these are items that we can talk about for a really long time. And I'll give you an example. One of my interests is cooking. Another interest of mine is my family. And another interest that I have is traveling. So those are examples of things that I could share and want to learn, and I can interact with people about for a long period of time without being bored. And goals, right? Those can be personal goals, career goals, community goals. But what's really important is when we start to share those individually, we can start to see some of the collective ways that we have shared goals, right? In our organizations, in our communities, even in our families. And then an example of a goal for me is I am trying to eat and be healthier. And so really thinking about the ways that I interact with food, and especially working from home during COVID, thinking about how do I make sure that I can, I love to snack and graze, meaning I eat almost all day, but still want to make sure that I'm being healthy while I do that. So that's a goal of mine. Your networks are all those relationships, and really thinking about who are the people that you depend on, but also the people that are individuals, organizations, the folks that make up those really important relationships to you. And it might be incredible to learn with the boys and young men of color we work with Together for Brothers. They really identify their families, parents as some of their most important networks and relationships and supporters, which I think is really great, right? Parents should be some of our biggest supporters and people that we can depend on. And then the skills that we bring could be like myself, who is bilingual, or a facilitator, or another one of my skills is that I'm becoming increasingly better at cooking and baking. So those are those skills that we want to bring to our asset map and share with one another. And then finally, our values. And this is one where sometimes boys and young men of color, but also the community partners we work with get a little stumped. But the values are what I relate to as being, what are the things that we learn from our ancestors or the ways that we prioritize? And I think one of the reasons I really want to highlight values is during COVID, we've really learned that even when we work together with organizations or community partners or other decision makers, where we have a shared goal, that oftentimes it's also really important to outline what are our shared values. And a shared value is focusing on most impacted communities. We're going to be talking about that a little bit later. Another value I have is art making as a core part of doing community organizing. Another value for me is really being an anti-racist. And so we're going to be talking about race and racism today, because I think it's core to any of the work we do, especially work around health equity. So I want you to take a couple of minutes, and even if it's just one of these assets, a goal, an interest, a network, a skill, or a value, what's one of your assets that you would put on your asset map? If you could use the chat feature in Whova and just put one asset at least. If you want to do multiple, that's great. But I want to read in the chat, what are some of the assets that you bring to this health equity work today? Thank you, Mariana. Thank you, Elizabeth. Thank you, Vanessa. Thank you, Blanca and Kristen, Gabriela. Appreciate you all. And as others share their assets, I just want to relay how important it is that for me, this is also a value, taking the time to really hear one another and see our assets, because I believe that our assets are our gifts, right? I believe they're gifts from ancestor. I believe they're gifts to community, to and from community. And so just really thinking, how do we express that we have assets, but that individually, each of us is an asset to the community, and especially to this important work for health equity. So thank you. Please continue to share what those assets are in the chat. I'm going to move along to talk about assets, connecting assets to storytelling. Here you see one of our staff, Baruch, working on a bike. It's one of the ways that we do our health equity work as Together for Brothers, by getting boys and young men of color most impacted into the outdoors safely, right? Especially finding that during COVID, it's really important not only for physical health, but behavioral and mental health and spiritual health to get outdoors. So I want to talk about some of the ways that we tell stories. One of the exciting things I want to share is that T4B uses a Marshall Gantt story of self model that we've actually adapted and added some tools that I want to share with you today. But stories are medicine. Stories are healing. They're about relationships and sustainability, meaning the sustainability of our work for health equity. And just taking the time for those introductions or hearing each other's assets, seeing each other's assets are really good examples. But I want to start with story of ancestors. Here you can see this is pre-COVID. It was one of the last times we did the Dia de los Muertos event at the National Hispanic Cultural Center to build an altar. This is in 2019 when the young boys and young men of color decided to do an altar to boys and young men of color we've lost to violence. So when we think of story of ancestors, I want you to think about those assets and values, right? We were talking about values being the ways that we learn from ancestor, or we create priorities, but I think about it as how we make decisions, right? Those story of ancestors or values are how we make decisions, how we create priorities, and how we create culture, right? And culture is created within ourselves, internally, in our families, in the long traditions that some of our communities have, right? Where we know going back to the land acknowledgement that our Indigenous communities have real important connection and story and story of ancestors going back to their origin stories, right into creation. And so all of that becomes a really important way for us to understand how we have to really think about health equity as being a real values-led framework. And how do we do that is we have to hear from each other, right? We have to make art with each other. We have to tell those stories about what our priorities are, how we make decisions, and what are the assets, and in particular, the values that we have in doing this health equity work. And there's also a really important story of self. And so, you know, Marshall Gans, who we borrow the story of self model from, reminds us that when we talk about our story of self, we're talking about three components: a challenge, a choice, and an outcome. Right, and I want to relate a story of self around my own work around transportation, and that, right, I am somebody who has committed to not own a car because I think of it as being an environmental issue. I also think about as a cost savings, a financial issue. It allows me, you already heard that one of my assets is that I have interest and a goal to travel. And so, you know, not owning a car means that I depend on primarily on the bus and sometimes rideshare. And what it means is I have become a big advocate for having affordable, and right now, very excited, right, in Albuquerque because of the work of Together for Brothers and many other community partners, have free transit. So my story of self is I, you know, really didn't want to own a car. I made a commitment to not own a car and to be a person that takes public transit. And now I've become an advocate for public transit, including serving on the city's transit advisory board, currently as chair. And so that story of self is, you know, for me, also, it's not about just people like myself who choose to use public transit, but to really understand that I want public transit that centers transit-dependent communities in that work. And so I'm really interested in who are the folks who don't have a choice but to ride the bus, and how we can really center their stories, center their needs and wants when we think of our public transit system. And that is a really good example of health equity, right? Putting the people most impacted at the center. And so I do want us to take almost a step back as we talk about storytelling. And I want to think of race and racism. This is something that you're probably familiar with, but I just wanted to make sure that we're all on the same page. And so race is, we know, a socially constructed, it's made by us, it's made by people, it's not biological, but it is a categorization of people based mostly on skin color and other physical characteristics that create a hierarchy, a ranking system of power, of prejudice and privilege in our communities and systems. And so again, race is socially constructed, it's not biological, but there are real ramifications, including racism, where we see power and prejudice. I'm going to define those in just a couple minutes. Power and prejudice, but really thinking about racism as institutional or systemic power and racial prejudice, and how that has an impact in our communities. And I think it's also important that we recognize some levels of racism as we think about health equity. We tend to focus on the individual levels of racism, the internalized racism that we have of ourselves, and interpersonal racism between individuals. I want to give a really good example of internalized racism. As we get ready to start summer in New Mexico, I remember being a very small toddler, 3 or 4, when my grandmother, who was an Indigenous Mexican woman, would remind me not to go out in the sun during the summer so that I wouldn't get too dark, right? My grandmother's experience with internalized racism also was passed on to me, to believe the darker skin I had, the less attractive, the less beautiful I was, right? And so we need to push back on those notions of racism. that we believe about ourselves, that we've been taught, unfortunately, from our families and also from society. And those interpersonal racism, where we often see those highlighted, where we see people, using either verbal epithets or having exchanges with one another where there's racial discrimination at play. I really want to, similar to what I've learned from Dr. Kamara Jones, and by the way, these definitions of levels of racism come from Race Forward, and there's a website on the bottom of the slide if you want to check out more information about levels of racism, including some really great videos. But like Dr. Kamara Jones taught me, right, with her gardener's tale, I really want to focus on systemic racism, and that is institutional racism that takes place in schools and workplaces. So institutions of power, the racism that's happening because it's our curriculum. It is the policies that those institutions put out. It's the way that they hire people or don't hire people. And that structural racism, where then how those institutions across society work together to start forming things like history, culture, ideology. And so that institutional and structural racism, if we can focus on shifting laws, budgets, policies, and those larger systems and structures, right, then I think changing the individual level becomes a lot easier. I definitely agree with Dr. Kamara Jones and her gardener's tale. If you're not familiar with that, please check that out. And why, in terms of health equity, is we're talking about health equity is an important, right? Health inequity happens because of the institutions, because of the structural ways that institutions work with each other in our healthcare systems, in our schools, in our workplaces, right, to make health inequitable. So I think it's important for us to understand these levels of racism as we do health equity work. And then I also want to introduce probably another concept, or not introduce, but just to kind of make sure we're on the same page. I know that folks are familiar with trauma, but trauma results from the experiences that we have, and they're not just the experiences, unfortunately, the adverse experiences currently, but the generational trauma that our families and communities have experienced. But I want to focus on healing. And I really want to bring in an incredible definition from a local organization that I have been really blessed to learn a lot from. Tewa Women United in Española teaches us that healing justice is that powerful tool to transform intergenerational and individual complex traumas into healing and reconciliation, and really thinking of the mind, heart, and spirit work that we need to do, right? I'm going to say it one more time. Think about that mind, heart, and spirit work that we need to do because of our love for ourselves, but love for each other. And that healing work is what I really want to focus the rest of the time that we have together this morning, right? Because I think it's important to say, let's acknowledge trauma, both current and generational trauma, but to unpack and move forward, we've got to heal, right? And that is an individual, collective, and also, right, an institutional, structural, and systemic process that we need to go through as New Mexicans to be able to move forward. And one of the ways that we do that, I think, healing, is recognizing some of the tools that we have in our health and public health work. You might already be familiar with social determinants of health. When we were doing health equity work with boys and young men of color, what was really important is identifying what some of those social determinants are. We know that your zip code can actually dictate more about your health than your genetics. And so thinking about what those social determinants of health are is an important part of the healing process, right? Because again, we want to really understand the problem. And in Together for Brothers, we really think about those social determinants of health, like access to education, access to employment, access to healthy habits like exercise and healthy food, but also access to recreation, including getting outdoors. I want to ask for just a couple of, to take a small moment to have you all reply. What are some of the social determinants of health? And I'm trying to get on my Whova app on my phone. what are some of the social determinants of health that your organization or maybe your program in the Department of Health or your community, what are some of those social determinants of health that you've identified? What are some of the social determinants of health that you, your program, organization, community have identified? Thank you, Bianca, thank you, Bianca, health literacy. Thank you, Janice, for bringing in housing. I know that's a focus of the Health Equity Summit, housing. Education, thank you, Marty. Absolutely, Amanda, that lack of access to care, right, especially in rural communities or low-income communities, and how that's connected to transportation and so many other issues. Thank you, Suzanne, for bringing in housing and food security. Absolutely. So we know that one of the things that we, the tools we have, and I also shared, right, New Mexico Department of Health has some great tools about learning and sharing with community, because as Bianca brought up with health literacy, we often need to build capacity of our communities, of our organizations to do this really important health equity work. So just want to lift up, New Mexico Department of Health has some great resources around understanding and learning about social determinants of health and how that's connected to health equity. So I want to hear some of your story of self connected to those social determinants. And I've already shared one of my stories of self around transportation. I'm also going to share that recently, right, I am 48 and have a history of colon cancer in my family. So one of my challenges recently is needing to schedule a colonoscopy and being a little bit nervous about it, having the good health insurance to be able to do that. And of course, going and getting a colonoscopy becomes a really important way of understanding health. So that's one example, right? Access to healthcare. There was a time when I didn't have access to good healthcare or health insurance, but I'm just really grateful for that. So that's another story of self. I want to ask you all, what is a challenge, choice, and outcome for you when it comes to those social determinants of health, when it comes to some of the issues that we're working on in our communities? Do you have a story of self connected to that social determinant? And unfortunately, we can't share with a partner, but I would love for even a couple of people who might feel comfortable to share their story of self on the Whovid chat. And as we do that, as we wait for maybe a couple folks who might be willing to share that story of self, thank you for folks for being brave. I want to remind us that our stories are medicine. Our stories of self connect us. And then the three questions that I just wanted to say as we think about health equity and story of self is, who tells their stories? Who tells our stories? Who tells your story? And in what languages do we tell our stories? In what languages do we tell our stories? And what mediums? How do we tell those stories? In what mediums do we share things like our stories of self? And as we do that, I want to encourage you all to check out the Together for Brothers website. Has some really great tools about using some non-traditional ways, like zines, little magazines that you make, video, poetry, as a way to share story and as a way to share story of self. Because when we have most impacted communities sharing their stories, this is how we move forward with health equity. Absolutely, Krista. That, and that it was one of the reasons where, family sharing stories internally, or even you sharing stories within a support network, but not being external with it. How do we, right, build capacity of communities, especially communities most impacted, like the story I shared earlier of immigrant mothers in Albuquerque? How do we build capacity for communities to share their own stories? I think about what I've learned from environmental justice, from that really critical, if you've ever heard of the HEMES principles, an international gathering, right, gathered in HEMES, New Mexico. And one of the things they really decided as the HEMES principles is that communities should speak for themselves. And that's why it's important for, in our health equity work, how do we build capacity for those communities most impacted to share their own stories? I know that so many of you are probably really familiar, but it's really important for us to understand as we talk about health equity, why we use health equity and not health equality, right? Equality is everybody getting the same. Equity is when everybody, and in particular, most impacted communities gets what they need. I'm gonna say it one more time. Equity is when everybody, and in particular, when most impacted communities gets what they need. And we know most impacted communities are communities who are impacted by racism and other intersecting oppressions, including that trauma that we talked about. There's a really good story that's a very short kind of like right allegory that someone shared with me about equality versus equity that I want to share, which is if we all were in a circle and we were all physically together and we all took off our shoes and we all said, everybody gets 2 shoes, that's equality, right? And then the problem with that is you get 2 shoes and it might be 2 left shoes or 2 right shoes, or you might need a special shoe because you have a leg brace that you are wearing, or maybe you don't get the size shoe that you need. And equity says it's not about everybody getting the same, it's about people getting what they need. And especially people who are most impacted getting what they need. So it's you getting the shoes that you need in that particular allegory, right? So again, it's not everybody getting 2 shoes, it's everybody getting the shoes they need, depending on their circumstances, and especially most impacted communities. And when we think about equity, there's an important piece around roots and rivers that Together for Brothers has been able to develop. And some of you might be really familiar with the babies in the river story, right? It's, the idea that we spend so much of our time pulling babies out of the river in the health work that we do, right? We're trying to work with people who are food insecure and get them food, or work with mothers to get access to good maternal care or childcare, or maybe it's having people with disabilities having access to the housing that they have a right to. When we think of making sure that people get what they need, we also need to start looking at what are the root causes, right? So the first parts of Roots and Rivers says, when we see a problem, we often see the presenting problem. And we know that affordable housing is a presenting problem, but if we understand the root cause of why do we see a lack of affordable housing in our communities, we often need to ask 7 times why. Why is that the case, right? Why is that happening? Why is that being experienced? And the best people to answer that question are the communities most impacted by the problem, right? So oftentimes we see, especially in public health, that we see the bureaucrats as being the folks who are answering that question, and just really thinking about health equity teaches us that it's the community most impacted that needs to be understanding those problems, right? The root cause of problems. And also going upriver, right? Going upstream to find the source of who's putting babies in the river. So we want to go to those solutions or systems change, right? Because we can give folks food. We can we found out during COVID, we could give people vouchers and get them into housing in hotels or motels. But we also need to look at how we change the systems so that we don't have to continue to pull babies out of the river, right? So those issues, the problems and solutions, including the root causes, need to be identified by the people most impacted. And that roots and rivers is an important concept of health equity. When we talk about problems and solutions, we're really talking about community organizing. I mentioned earlier when I did my introduction, I am a community organizer. I was taught community organizing in high school and college as being from a most impacted community. And so I just want to review what are some tools of community organizing that I think are also tools for health equity. In health equity and community organizing, we have to know the 3 Ps. We have to know that power is the ability to get what we want. We have to know what prejudice is, prejudging or preconceiving others based on their identity in a particular group, and privilege is having that advantage over others. And one of the, and with the 3 Ps, everybody has them, right? We all have power, we all have prejudice, we all have privilege. But going back to that slide where we talked about levels of racism, the thing that we have to understand is there's institutional power, institutional prejudice, institutional privilege. There's structural power, structural prejudice, structural privilege that are deeply entrenched in racism and other intersecting oppressions. And so we have to use our collective power, right? We have individual power and institutional or structural power, but there's also collective power to change things. There's also collective privilege for us to act together in community organizing, using a set of strategies and tactics to use that collective action and power to win campaigns in our community, right? And it's important to recognize that health equity is so deeply tied to collective power, action, and community organizing, where we build power, where we make sure that people understand the power that they have. So it's not giving power, but it's making people realize that sense of power and building their capacity to use that power, right? I like to think of everybody being a superhero, and the part of community organizing is helping people realize how to use their superhero powers. We also want to improve people's lives, and this is so connected to health equity, right? How do we improve people's health and health outcomes, and not just, again, pulling them out of the river, but having them be part of that systems change work that needs to happen so that we can actually shift culture and shift relations of power in our communities here in New Mexico. So those 3 principles are really important for us to understand. And then going back to one of the basic pieces of community organizing, and I believe health equity, is understanding that issue. And oftentimes we think of an issue as a problem, but I'm going to remind us that an issue is the problem and solution, and remembering it's not just the presenting problem, but the root cause of that problem, and a solution that represents a systems change as identified by those most impacted in our communities. And if you think about the health equity work, right, is we don't want Band-Aids, we want real solutions, right? We want real solutions and systems change that come from the community, come from the people most impacted, where we have to do some unpacking of root causes and go past presenting problems to really understand what's happening in our communities. And so I want to have you all practice the story of us. Marshall Gans teaches us the story of us is that problem and solution. I want you to think about roots and rivers. We know that it may not be, you might need to do more work in your organization or community to hear from community what collective problems and root causes of those collective problems and collective solutions that are focused on systems change. But I know that some of you have been doing this work for many, many years. And so in the chat, if we can take a moment, I want to hear from you all. What are your stories of us? And I want to give a really great example. One of the things that Together for Brothers has focused on is access to the outdoors and making sure that communities have access to language, language access. And so one of the things that we realized is a lot of the signage in outdoor spaces is English only. And so this picture illustrates what Duke, whose family is Vietnamese, and Saeed Mahdi, whose family is from Afghanistan, they wanted to illustrate that for some communities in New Mexico who want to have access to the outdoors, not having signs in other languages other than English becomes a real challenge, right? And so they are taking this photo to talk about the problem and solution of language access when it comes to outdoor equity. and making sure that all communities in New Mexico, regardless of the languages they speak, have access, equitable access to the outdoors. I'm going to check the Whova app and see what are some of the stories of us, your problems and solutions in your organization, in your community. And again, even if you haven't already shared in Whova, take a moment and just answer, what's a problem and solution that you've identified in your community connected to health equity? Thank you, Bianca. Thank you for bringing up capacity for healthcare and the provider shortages. Santana, thank you for bringing up that centralized hub for care. And maybe share what's the problem that a centralized hub of care would be a solution for. And that is a great solution. Again, just waiting for maybe one or two other people to share. Thank you, absolutely. Janie, the transportation and distance for rural communities, absolutely. And would ask you, what's a solution then for for Cuesta and other communities like Cuesta in terms of being able to access services? What's a potential solution for communities like Cuesta? And thank you, Jess. Yeah, I think in transportation in rural communities and location of services is so important. And another, Jess, what would be a solution to having more mental health available in our community? So again, I'm hoping that you're starting to think about why these stories become important and why we need to actually have people most impacted, not just those of us that are doing the health equity work, but we need to pull others to do this health equity work with us. And that part of that work is that story of now. And I want to highlight just some of the responses in the Whova chat around the ask is, how do we get more funding for transportation in our rural communities and actually all communities, right? It makes me bring up, because I know that transit equity is I'm a big champion for. We currently don't provide, right, funding for transportation services. As a state, you have to get that either from your local or at the federal level, and then it's really hard. Or what's that ask for mental health care in our state? What's the ask for Cuesta when it comes to, oh, and thank you, Janie, for kind of bringing up some of those, some possible solutions in Cuesta. So thinking about the now is, what's that ask that we're making of decision makers? Either, and this usually comes in the form of laws or budget, or sometimes it's just listen to community. And in this case, one of the things you see is one of our youth organizers, again, sharing his ask about some of the work that we've done around access to food and access to outdoors, where we're really encouraging communities to really think about equity in very different ways. So that story of ancestors is your values. Story of self is that individual challenge, choice, and outcome. Story of us really goes back to the collective problem and solution as identified by the most impacted communities. And the story of now says, this is what we need and want. And I want to just iterate, with health equity, we need communities most impacted by health inequity, by those health disparities, to be side by side doing this work where they're sharing their stories, including that story of now. I want to start to wrap up, and I want to leave you with, as we talk about health equity, I think it's really important that as New Mexicans, we start to really move from transactional relationships, which is about a get-give, right? Usually that has some kind of financial exchange or incentive. We need to move past that transaction, like, oh, I'm gonna do this because of what I'm gonna get out of it. We need to move to transformational relationships where we focus on healing, we focus on our interdependence, right? That we're all connected to each other in this beautiful, right, web or web of webs with each other, right? That we're all weaving these webs together. And that mutuality, right? That the idea that we're in this together, and that is particularly, by the way, I think, you know, to bring up in health equity, how we have to push back around both white supremacy and classism is we need to slow down the pace of what we're doing, right? The idea that we're gonna get to goal, we're gonna, you know, make people not be in poverty in a year, or have to do things in a very hurried way, often means that we don't do it in the way that we need to build those transformational relationships. So one of my biggest pieces of advice, and I think what I really learned and hope maybe you learned too during COVID, is to slow down and to give ourselves that spaciousness that we all deserve and need, but also slowing down for most impacted communities to be able to be at the center, right, of that focus on healing, interdependence, and mutuality. And then, you know, that's where I think the healing for the health equity comes from, is, you know, in this beautiful picture of, you know, T4B getting boys and young men of color into the bosque, this beautiful ecosystem, right, that's shared by so many communities in New Mexico, the Rio Grande Valley, the Rio Grande as a river system. But just to say that healing takes place in so many different forms and ways. Our stories are medicine, our art is medicine. Being able to be community organizers with each other is that medicine. And I do wanna try to make some time. I only have a couple of minutes, but maybe there's one or two burning questions that you have, and then I'm gonna make a commitment. I promised Bianca and Suzanne I would answer questions on the Whova app after the presentation. But are there any, when you think of maybe a story you've learned during COVID, and if you have a moment, I'd love to hear what you did and learned, what you would change or what you liked. But I really want to hear your questions or what's alive for you in the chat. I wish we could take people off of mute. I appreciate using Whova so that we can continue to follow up. But I'm gonna move to stop sharing my screen. And here in Whova, if there's a question or what's alive, we often ask, right, what's alive for you? What are you thinking about right now? What are you taking away from this very short hour that we were able to spend with each other?
So Chris, this is Bianca. I want to remind everybody that you are able to unmute. So if you do have a quick question, you could raise your hand. We can start there and unmute some folks. I do know there were some questions on the Whova app, so we can go back to that if nobody raises their hand. So you're welcome to unmute if anybody is interested.
And maybe while we're waiting, Bianca, for others, can I just answer, you know, there's a really great question about being ready for healing. And one of the things I want to say is I think as a public health folks who do maternal health or housing, we know this, folks have to be ready, right? We have to, you have to be ready, we have to be ready. And there's things we can do to make people ready, right? Like we can make space, just like we did today, like with gender pronouns, like making space for people so that when they are ready, they know that you want to be that do that healing justice, that healing work with them, right? So can I share a story? There's a new community safety department in Albuquerque that's sending out social workers instead of police. And I really appreciate my friend Mariela, who's the director, sharing with me that for some of our unsheltered relatives who don't have a lot of trust for police or for city officials, they know that they have to build relationships once, twice, 3 times, 4 times, 5 and 6 times, connecting with someone so that that person's, okay, you know what, I want to know what my options are to maybe get off the street tonight, right? But it's not going to happen the first time because people aren't always ready for that healing. And I think that, you know, being patient with ourselves, with each other, and not forcing healing, because that healing can't be forced, health equity is something that requires all of us to be part of, right? It's that African proverb: if we want to go fast, go alone. If you want to go fast, go alone. But we're trying to go far. That means we need to go together. We cannot leave any New Mexican behind. And so how do you make space so that people know when they're ready that they have your organization, your program, you as an ally supporter available? And I think it's at 11 o'clock, so I will, again, make that commitment. I'll follow up with people on the Whova app. Suzanne, Bianca, thank you so much. I think we're at time, right? So we should, in a good, healthy habit, we should end on time.
Yes, thank you so much, Christopher. I really appreciate it. That was wonderful. As he said, he will reach out to everybody with their questions. I believe there was probably a handful of questions, Christopher, on the Whova app, so you could reach out to them or answer them through the app. I just have a couple reminders for everybody. All materials and everything's going to be recorded. So if you wanted to watch this back, it will be on our website, nmhealthequity.org. And it also will be on the Whova app probably through the month of May. So you could always go back and rewatch it. Please remember to click to complete the evaluation. And that's also how we track your CEUs. And if you have any questions or you run into any issues, you can always email me at bianca@constellationnm.com.
Yeah. And Bianca, can I just say one last thank you
Yes,
to all of you doing work around maternal health, housing, and health equity in New Mexico. I just want to send you lots of good vibes and good energy and gratitude, because it's such hard work, especially on a day, right, where we're finding out that the Supreme Court might be taking away healthcare access for female-bodied people, right, in terms of abortion care, which is a human right, and healthcare. I just want to thank you all for the really important work you do for New Mexican communities across our state. So thank you so much. Interact on Whova. Check us out on togetherforbrothers.org. You can sign up for our listserv on our main page of our website. Bianca, Suzanne, thank you again for the opportunity. And again, lots of good energy for all of you doing this really important health equity work in our state.
Thank you, Christopher. I appreciate it. Have a great rest of your day, everybody. We will be back at 1 o'clock for our next session. We will have Jardín de los Niños talking about enhancing the lives of children and families through trauma-informed, strengths-based services and community collaborations. Thank you.